Bridgen.
Thank you, Mr Deputy Speaker. Whenever this House passes legislation, it is essential that it is effective, evidence-based, logical, and it needs to have broad public support. And what I see in front of us today in regard to Plan B delivers on virtually none of these items. Indeed, if I look around social media, look in my constituency email inbox, or just go in general conversation with others, it's clear that these measures before us today are being treated with strong suspicion of a wider agenda, partly because they simply will not deliver on their supposed intentions. Sadly, today, the party opposite will be supporting the government as legislation passes to introduce vaccine passports for the first time in this country. So it will fall to backbenchers on this side of the House, the only people who will be subjecting these proposals to any sort of scrutiny. No doubt Her Majesty's loyal opposition would also like to partake in the proposals to discuss mandatory vaccination as well, given the fact that they have supported every one of the government's lockdown proposals. Indeed, they've demanded longer and stronger lockdowns than we've had. It would be remiss of me not to highlight the risk to the NHS that both vaccine passports and mandatory vaccination would bring. Vaccine passports tell those unconvinced of the science or those who, for health reasons, cannot take the vaccine that they're second-class citizens. They must show their papers or be banished. Mandatory vaccination would take these things a step further, effectively imprisoning anyone who doesn't agree with the status quo. All these measures are being considered, or may be taken, to protect our NHS. And all this fixation on the vaccine status of health and care workers, yet we know from the science that vaccination does not prevent transmission of the virus. So why are we going to put tens of thousands of people out of a job at a point when the NHS itself is going to be stretched to the limit? And may I add, when their vaccination status makes them little more or less dangerous to the people they work with or work for if they're tested daily. Indeed, the best protection of all is actually having had the virus and then be recovered. The scientific evidence shows that that is often 10 to 20 times less likely to be reinfected if you've already had and recovered from the virus than if you're double vaccinated. And yet, many thousands of individuals in those key worker roles who've had and recovered from the virus but refuse to have the vaccine will actually lose their jobs at a key time. It is an inconsistency. Turning to the necessity of these restrictions, there have been, no doubt, far fewer deaths due to Omicron variant in South Africa, despite the fact that it's been prevalent for 4 months and has replaced other variants there that were more deadly in various waves. All the evidence we're hearing is that Omicron is a milder form of COVID with fewer cases of serious disease, fewer hospitalisations and, thankfully, far fewer deaths. Mr Deputy Speaker, in my view, the most dangerous epidemic sweeping the world and sweeping our country is an epidemic of fear. It has seriously damaged mental health and in particular damaged the mental health of our young people. It must end.
Rachel Maskell.
Thank you.